For a resistant rheumatic chorea, it's more or less the same question, valproate. Now, when pKa becomes equal to pH, for every molecule there is a pKa value. There is a point at which the ionic and non-ionic components are equivalent and it is in a state of equilibrium. Then the concentration of the drug is 50% ionic and 50% non-ionic at the pKa value, whenever the pH is at the pKa value. Hydrocortisone physiological dose, very difficult to guess unless you are regularly administering it. Even if you are regularly administering, you should know what is the value at which our hydrocortisone is produced in the body. 10 mg per kg per day. Colchicine, how is it effective in acute gout? Basically, gout is because of the destruction which is caused by the macrophages which come and attack the joint. So, it will basically cause the inhibition of the granulocyte migration by inhibiting the microtubulin formation is what need to be remembered. One ab के बिना PG मेडिकल एंट्रेंस होता ही नहीं. Trastuzumab, Basiliximab, Apiximab, etc. So Basiliximab is basically a interleukin 2 receptor antagonist. You must know that list definitely. So this is how the T lymphocytes, IL-2 come and binds, and IL-2 receptor antagonist would be Basiliximab. Then it is an anti-CD25 antibody, basically monoclonal antibody. Pyrenzipin decreases the acid formation. So that's the reason it is used. It is a selective anticholinergic drug. Acetylcholine stimulates acid, anticholinergic decrease acid. That's how it is a M1 anticholinergic drug. Antipsychotics are divided into typical and atypical antipsychotics. But which antipsychotic among them is typical and atypical, you should recognize. Risperidone is the one which is a typical antipsychotic which lead to the development of increased prolactin production, risperidone therapy. Now, glucocorticoid production, yes, please have some good cup of tea. If you take metidapone, it is the inhibitor of 11-beta hydroxylase and that decreases the cortisol production is what you need to remember. Prasugrel, how does it basically function? If you look at pharmacology, one of the favorite questions, topics, high yield topics, anti-platelet drugs. Similarly, anti-thrombotic drugs is the most high yield in the top 20 topics given. Without that, there is no paper. So, clopidogrel typically is a prodrug and it becomes converted and it is a broken by esterases and typically it is antiplatelet. Prasugrel will have intestinal absorption, it will undergo hydrolysis, it is also a prodrug and it is also having a antiplatelet action is what need to be remembered. QT prolongation is one of the oldest topic. So you should remember quinidine is one of the drugs, sotalol, procainamide, disopyramide, phenothiazines. They are all the ones which lead to development of the prolongation. Sacubitril, another impossible question, right? It's a DM cardiology question. Sacubitril is used along with valsartan. So how does it basically act? It acts on something called the neprilysin. Neprilysin is one which acts at the level of the angiotensin 2 to angiotensin 2 binding with the receptor. At that level, the neprilysin functions. And that is how sacubitril can have a synergistic effect if you use it with another angiotensin receptor blocker like valsartan. So that's the reason you use the combination of the two in the management of refractory congestive heart failure. But little, is it an old question? Little out of the game, but still. Niacin typically is known to lead to glucose intolerance. This is one of the oldest questions. Endothelin acts basically, cyclic GMP is the secondary messenger. If you look through physiology, top 25 topics, secondary messengers is the favorite topic. What are all the drugs, what are all the situations where cyclic GMP is the secondary messenger? Even is for the endothelin, which is the alpha 2 agonistic agent, which is a muscle relaxant. Typically tizanidine, clonidine, tizanidine, they are all the ones which are alpha 2 agonists, and any alpha 2 agonistic drug is known to lead to development of orthostatic hypotension, because you know very well, no, where does alpha 1, alpha 2 act and where does beta 1, beta 2 act. I don't want to go into that. But autonomic nervous system pharmacology, if you are not good, get good now. All beta blockers, which is a sympathomimetic beta blocker, which is membrane stabilizing beta blocker, all the classification funda is there. No, you have to be 100% sure, right? We have one excellent teacher, Dr. Shailendra, teaches pharmacology with us. He is like a flowing river Ganges when it comes to pharmacology, right? So he will be taking the pharmacology sessions on Saturdays, Sundays, where a lot of his videos are there on our online video library, right? Apixaban, what is this? So apixaban is a direct factor 10 inhibitor. Once more, one more question on anticoagulants. Two questions, one antiplatelet aa gaya aur ek anticoagulant aa gaya. Definitely they will ask this. Typically, factor 2 is called thrombin. Active factor 2 is thrombin, inactive form is prothrombin. All effort of intrinsic and extrinsic pathway is what? Ultimately to convert prothrombin to become thrombin. For that you require factor 5 and 10. 2 into 5 is equal to 10. 2 into 2 is prothrombin. Into 5 is equal to 10, easy to remember. You require 10 and 5 in order to make 2 become 2A. So, the apixaban acts like an inhibitor of factor 10A, so that it prevents thrombin formation, act like a anticoagulant is what you need to basically remember. Anaerobes intrinsically are resistant to the action of aminoglycosides, because they lack that oxidative mechanism, and aminoglycosides कैसे काम करते हैं? वो अंदर जाने के बाद काम करते हैं. अंदर जाने के लिए, सेल के अंदर जाने के लिए जेब में पैसे होना है. एनारोब के पास पैसे नहीं है. Oxygen is not, they don't know how to use oxygen and give energy for aminoglycoside to enter into the cell. So aminoglycosides are not effective on anaerobes. That's the reason we use metronidazole and all this against anaerobes, which is a bacteriostatic and cidal drug. These are all basic topics, doctor. If you answer these questions wrong means putting one's own foot in the mouth. Be very sure, right? So I say answers, वो भी coaching लेने के बाद. You know what is the advantage of taking coaching? Coaching लेने के बाद अगर सीट नहीं मिले तो बदनाम करने के लिए कोई मिलता है. इनके पास गए रहे, इसलिए मैंने आंसर नहीं किया सही तरह, right? So if we fail to teach what is bacteriostatic, what is a bactericidal drug also, what for you are paying fee and what for we are conducting hours together of coaching, right? So that's what is the question. So tetracycline, sulfonamides, clindamycin, macrolides, lincosamides, you must know what are the group of bacteriostatic. Whereas aminoglycosides, cephalosporins, fluoroquinolones, metronidazole, penicillin, vancomycin, they are all called bactericidal drugs. Melanosis coli. Which laxative abuse will lead to melanosis coli? Senna. If you use Then endoscopically, if you look at the colon, all that pigmentation comes in those who use regularly the sera. Piku movie देखा ना? Piku अमिताभ बच्चन का movie क्या है? Piku. So melanosis coli, you can remember that. Attention deficit hyperactivity disorder. Hare zami par. For every disorder there is a movie, right? Final movie is, most important movie is Kaun Banega Karodpati. NEET PG with negative marks is like KBC show. So examiner will be asking you, lock किया जाए, lock किया जाए. By chance वो आवाज सुनाई दे रहे हैं और you feel that you know this answer and answer it with a wild guess, you are locked. So catheter related UTI and pneumonia, दोनों है तो खाली beta actum नहीं चलेगा. Clavum, you have to add a clavulanic acid also along with amoxicillin. Mycoplasma don't have a cell wall, that's the reason ceftriaxone like drugs cannot act, because they act by inhibiting cell wall synthesis. Tadalafil should not be used with what? So basically, tadalafil is a vasodilator. It is used for erectile dysfunction. It will smoothen it relaxes the smooth muscle of the vascularism of the penile vasculature. Same time, if that granipa is taking nitrates also for the ischemic heart disease and also want to be a hero on the bed and takes tadalafil also, he will be dying in coitus, right? So be very sure. Then how do you estimate the volume in burns? Oh, this is one of the favorite area. So you should be quite sure 4 into weight in kg into percentage of the burns. So please calculate here kitna hota. 4 into 50 into 40 is 8000 ml. Give first half in the 8 hours and the remaining thing based on the urine output. Who is a posthumous child? A child born after the death of his biological father is called as posthumous child. McNaughton's rule is IPC 84, easiest question on the planet. If you did this wrong also, then you are amoeba stage. Then bluish discoloration of gastric mucosa is emetol sodium, and copper sulfate mein blue hota, ferrous sulfate green hota, nitric oxide yellow hota. At least until getting seat we have to remember all these colorful facts. After that you can give your brain for a quick dry cleaning wash. Freshly start PG. Muscle pain, nephropathy are typically a feature of arsenic poisoning. First organ to putrefy, kaun hota hai? You must know larynx, trachea, followed by stomach, intestine, then liver, spleen, then brain, lungs, then heart, kidney. That is the order which you have to be very, very sure about. So among the organs given, brain is the one which putrefies first. Lakh's principle of exchange. Oh, this is one of the oldest questions. Base occiput fuses base sphenoid when? Impossible question. You answered means only paper out batch. POB, paper out batch, right? So 18 to 21. Don't say that I answered this question also right. Means you can start a investigation on that guy. How did he answer that also right? What is the smell of a mummified body? Is it jasmine smell, rose smell, what smell? Another question, prepare होने से answer करने वाला question थोड़ी होता है, right? Pure guess. So most peculiarly looking is odorless. Maybe that is the answer. The reason is a mummy is odorless mummy, and all the internal organs are removed out of mummy. That's the reason. Proximal tubule injury with proteinuria is the problem in which case? In cadmium toxin. This is one of the favorite question. PCT toxins, proximal convoluted tubule toxins. This is impossible question unless you are ready for a Nobel Prize for child labor. उच्च article for child labor कहाँ मालूम होता है आपको? We ourselves are child labor as house surgeons, right? So we should know what are the articles that protect us, right? So I leave the literature. Now in the Factory Act, below 14 you cannot engage someone under the Factory Act. It prohibits the employment in the children below 14. Then 4 is the incidence. 2 years में what is prevalence? I think cheapest question. ये आंसर करे तो नहीं आंसर करे तो जाके फिर और एक बार SPM पास होना पड़ता है. Exit exam, right? 8 incidence into duration is prevalence. Cytotoxic drug disposal कैसे करते हैं मेरे भाई? Landfill. So you must know yellow color, red color, blue color, black color, baba, black sheep, have you any wool? What is the color? That is the cytotoxic waste. So NRR 1 is only possible if 60% are using condoms or any of the protection methods. This is too much. What is the RNTCP software online? Recently we gave to government an app called Davakhana app. I think that will also come in the question paper in future. So monitor TB control program, NICSHI is a web-based solution, but a very good solution, very well adapted, right? Study unit of a ecological study is a population, is a study unit. Unit of observation is a community or a population in case of ecological studies. 90 are positive in a screening test. There is gold standard test. That means if you use a gold standard test means they are all true positives. True positives are 100, but only 90 got detected. 10 were not detected even though they are having the disease. So though you have a disease, but still if you turn negative for a study, what is that called as? False negative. So sensitivity is basically the true positives by true positives plus false negatives. That means all diseased. So that gives 90 by 100. That's how the calculation comes. But remember doctor, sensitivity, specificity, odds ratio, uske bina koi question paper hota kya? You have to crack this. If you lose this, no, that 210 questions may suppose it to do at Caudy-Quina level, you are still thinking what is false positive first time in the exam hall and then making a algebra equation of Albert Einstein. You're out of the game, right? Then somebody was complaining, मुझे एक white paper bundle भी नहीं दिया है calculations करने के लिए. Calculations करने के लिए तू कोई algebra, you are not supposed to become Aryabhatta or C.V. Ramanujan. वो जैसे complex mathematical problems थोड़ी है वो. Smell and answer. If you are not doing and making complex calculations, you are out. Meningococcal meningitis, what is the chemoprophylaxis? Typically rifampicin. Then chlorination made is the hypochlorous acid, which is the most active form of anti-infective action. Kala Azar ka endemic areas. Abba. If you are a proper Chennai student, still you should know Kala Azar endemic areas. Be very sure because it is one single NEET, right? So you should know UP, West Bengal, Bihar, Jharkhand, Pura northeastern India is the only place where you have Kala Azar. You can remember China for Kala Azar. Because northeastern side only, you have got all our neighboring countries. Risk among exposed by risk among non-exposed is called as relative risk. Cigarette पी के कैंसर आए तो risk among exposed. Husband smoke करके, the wife who is separated from the husband also is getting lung cancer means risk among non-exposed. The ratio is relative risk. Then Pasteurization. What is the temperature? 63 degrees for 30 minutes. Time gap between two vaccines should be at least 4 weeks. Then susceptible person within incubation period developing from the primary contact is basically called secondary attack rate. But you all know, no, secondary attack rate calculation you will never include the primary case in the numerator. Then out of 100 women, 10 women got pregnant in spite of using contraception and followed for 24 months. Peril index is a favorite question, standard question. Number of pregnancies into 12 by number of women into number of months into 100. That will give you 10 into 12 into 100 by 100 into 24 is equal to 5. Is what need to be remembered. Which will not cause the hardness of water. So you must be sure temporary hardness is because of the calcium bicarbonate, magnesium bicarbonate. Permanent hardness is because of the calcium sulfate. So the types of hardness, what are the things responsible for the development of the hardness, etc., you must be quite sure about. So bicarbonates and sulfates are responsible but not carbonates. Carbonate hota hai soda. The Pepsi you drink is carbonate, not bicarbonate, right? So bicarbonate, sulfates are responsible for hardness. It's a tricky question actually. Now, direct transmission in communicable disease, which is not an example in communicable diseases, direct transmission. STD, soil, transplacental, they are all mentioned but not respiratory. Indirect transmission you are having vehicle borne, water, food, milk, vector borne, mechanical, biological, etc. So, but droplet infection is there, no direct transmission We'll come back to this. So, yeah, we'll go to the next.